You know, Abdullah? What is the number to call in Dubai if there is an emergency? Sabi ni Christine, 998, 997. Triple nine, Abdullah said.
998.
Okay.
998.
998, sir, for ambulance.
Okay. Okay, well, it looks like everyone is, oh, not everyone, but at least majority of you knows the number to call. Now, this is always my highlight whenever I talk in a class, that I want you to ensure that while you're working in the hospital, you always make sure that your safety is on top of your priority, okay? Whenever you go to another country in the future, guys, please make sure that you know the hotline for the police, for the fire, and for ambulance if in case something happens. You will never know when you will need that, okay? Aside from that, when you are, like for me, I travel, I go anywhere, whatever, so I always make sure that I know where's the exit, okay? So if you're working in a hospital, especially in the big hospitals, you have to know where to exit if in case there is an emergency. Or maybe just here in Dubai, if you are staying in a flat, you have to also make sure where to exit in case of an emergency. So you have to think about that and really like think clearly in your brain, in your mind, because sometimes during an emergency, the electricity shuts off. So may blackout. So if there's a brownout or blackout, then it will be more difficult for you to go around the area and exit from that building, right? So please don't forget that when you are already in another country, one thing that you have first thing to do is to set your emergency alarms. Know the emergency number, know the emergency exit, know where to hide, you know, all that stuff. I couldn't stress more on that. Okay. But all over the world, universally, there is what we call the Good Samaritan Law. I will explain that to you later. But here in Dubai, they have said, according to them, that we are not allowed to touch victims or patients in the emergency scene or in the crime scene. So we will let the professionals do the help. So the best thing we could do really is just to call 998. 998 is for ambulance, 999 is for the police, and 997 is for fire. You know how I remember that? You know the number 7? It looks like fire extinguisher. Yung fire extinguisher, parang may handle siya, tapos may hose na 7. So 997. Okay? Yon. All right. So we will talk about CPR. Let me share a screen. So CPR, guys, is just one of the it's just one of the things that you have to discuss when you talk about the basic life support. So basic life support is a bigger umbrella, okay? Basic life support is a big topic. It's a wide topic, which includes CPR, which is one of the topics. Another topic is fire safety. Another topic is bandaging. Another topic is first aid. So as much as possible, we try to touch in all of those little by little, okay? But we will be focusing today about CPR. What is CPR, Lujin?
Oh my God.
What is CPR? Ayan, on your screen, read.
Wait. Cardiopulmonary resuscitation.
Okay, now let's dissect that one by one. When you say cardio, what do you mean by cardio?
Heart.
The heart.
Heart.
Okay.
Heart.
Yes. First thing that comes into our mind is the heart. When I say pulmo or pulmonary, what is this?
Lungs.
That's right. And then what is resuscitation?
Process of
What is the Tagalog of resuscitation?
Pagbigay hininga.
Pagbigay hininga. Pagbigay ng hangin, ano ba? Pagkabuhay.
Kabuhay.
Pagkabuhay. Okay, so basically, guys, in a very easy and simplest terms, cardiopulmonary is just reviving the persons or the victim using their heart and their lungs. So there are no other organs involved in the CPR but your heart and your lungs. So when you push the patient's chest, you are focusing on the heart. And when you put an air, you're focusing on the patient's lungs. So those are the only two organs that you must hit when you're doing a cardiopulmonary resuscitation, okay? In science, it's a technique of BLS for oxygenating the brain and heart until appropriate and definitive medical treatment can restore normal heart and ventilatory action. O, di ba? Ang hirap intindihin. Pero yun lang yun. Cardiopulmonary, heart, lungs, resuscitation. Next. So the purposes obviously is to maintain airway, to provide ventilations, to save a life of your patients, and so on. I will discuss more about that later. Now, these are the types of, these are the scenarios where you might need to provide CPR to your patients. Number one is drowning. What is the Tagalog of drowning?
Nalulunod.
So obviously there should be no water in your lungs, but because you were drowned, okay, the water entered your lungs and then you cannot breathe anymore. So if you cannot breathe, you might collapse or you might die. Okay, then probably CPR will be required on that. How about stroke? What is stroke?
Stroke. Like
Yung,
heart stroke.
Yung
It's
parang
yung parang high blood stroke.
oxygen.
Oxygen in the brain.
In the brain, correct. So if there is no oxygen in the brain, that's what you call the stroke. How about naman if there is no oxygen in your heart? What do you call that condition?
Heart
Attack.
Correct, heart attack.
cardiac attack.
Cardiac attack. It's either heart attack or cardiac arrest.
Cardiac arrest pala.
Oo. Pag
Cardiac
sinagol mo, pag sinagol mo yung dalawa, cardiac attack.
Hijack.
Hijack.
Okay.
Sinagol lang dalawa.
Now next, foreign body in the throat. So
Nalooban.
na bilaukan or
Nagbilaukan.
nabilaukan. Yes.
Bulunan.
Nabulunan, yes.
Nabilaukan.
Bulunan.
Yep. Smoke inhalation. So when you say smoke inhalation, like for example, there's a fire and you were sleeping and then you didn't know that there was a fire. So you were poisoned by the smoke around you. Or another one is, for example, you are in the parking lot, for example, and there is no enough ventilation and you were sleeping on your car and then you inhale the rest of the carbon monoxide, which is yung buga ng mga sasakyan in the parking lot. So it could also cause death. You know, drug overdose, you understand that. Suffocation is when you are like this. So if na-suffocate ka. Accident, obviously, and comatose, you know what's comatose. What is this about? Epiglottis paralysis. So if you can look at me on your screen, your throat, guys, here, there's two tubes, okay? So one is your trachea, which is the pathway of your air, and the other one is your esophagus, which is the pathway of your food going to your stomach, okay? Now, there's a flap or a door here that opens whenever I talk or breathe, and then it closes and opens on the other side whenever you ingest a food. So pagkakain ka, bubukas sa likod. Paghihinga ka, bubukas dito sa harap. So pag ganun-ganun lang siya, okay? But for some reason, there is an epiglottis. So this is your epiglottis. So there's an epiglottis paralysis. So this flap or cover here is paralyzed. So therefore, hindi siya nag-o open and closed. So if this remains closed, therefore you cannot breathe. So yun yung epiglottis paralysis, which can cause death. So these are just some of the scenarios where you might need to put or to give CPR. Okay, but what happens for you guys since you're a CNA? Normally, honestly, to be honest with you, in the hospital, the CPR is done by the doctors and probably some nurses, not by the CNAs. Okay, but then again, I want you to be again aware of how the CPR is done. It is best, I believe, that for us, especially for the Philippines or Filipinos, that at least one member of the family in the household of the Filipinos knows how to provide CPR. Because you will talaga never know when you're going to give CPR, and especially the access to healthcare in our country, in the Philippines, it's very, very poor, no? The moment that you arrive in the hospital, your patient's already dead because you have to go by the alley, yung skinita, tapos sasakay ka pa ng tricycle, walang ambulance, traffic, pagdating mo doon, hindi ka pa entertainin and whatsoever. This can probably help. But I hope that you will never ever use this, but in the hospital, this is very useful. At least ngayon, there's already an advent of technology that you don't have to manually do it. But then again, in my class, you have to do everything manually. So once you know the manual, later on, you would understand how to do the automatic or the machines. Okay, Next. Now, this screen here is very important. So if you look from the bottom going up, okay, let's start from the bottom here. Okay, according to this, they said that within 0 to 4 minutes, brain damage is virtually non-existent. Therefore, if, for example, you had a heart attack, you were drowned or whatever, you had a coma or whatever situation, okay, within 0 to 4 minutes, if the people can help you revive, then there will be probably no brain damage. So the brain damage is less percent. But in 4 minutes, the help or the rescue team only arrived in 46 minutes, then you have to expect brain damage. It's very, very possible. However, beyond that, beyond 6 minutes or 10 minutes, if still you were not able to, you were not helped, and then the help only came at 6 to 10 minutes, then expect that once you are revived, there is a brain damage. So, sino bang kalaban natin dito? Ang kalaban talaga natin dito is yung oras. The enemy here is the time. So the moment that you notice or identify that your patient is having a stroke, having a heart attack, or whatsoever, while you're probably changing the bed linens or doing the bed bath, or maybe getting the stool or draining the catheter. Once you notice your patient is already not normal, then you have to alarm or set an alert to your nurses that something is wrong. Okay, then the nurse will have to identify whether they have to call the doctors or not to provide CPR. Okay, so remember, if you, for example, if you are at home and then you're taking a bath and then 10 minutes, 1 hour, 30 minutes, hindi pa siya lumalabas, they're not coming out of the toilet yet, what is wrong? Is everything okay? And nobody is responding. So the moment that you realize that maybe your kuya or your uncle is already having a heart attack inside the toilet, it's already too late. They're already dead because it's too late that you've identified that someone is having a heart attack. However, if you're able to provide,
Sir, please, can I ask a question? When you are giving the CPR, at what time should you stop if so the person is not reviving?
I will answer that later. Okay, I will get there.
Okay.
Now, the answer to that is actually just stop. Okay, STOP, so that you can easily remember, which I will declare. Which I will talk later.
Okay.
Okay, now this is a Good Samaritan law. Can you say Good Samaritan law?
Good
Good
Samaritan.
Samaritan Law.
Yes. According to the Good Samaritan, universally, guys, actually the law states that as a layman or as a person, like a normal person, normal being, whether you're a doctor, whether you're not a doctor, they always encourage us to help one another. So, that's the Good Samaritan law. Now, if you help and the person has been revived, then good for you. But if you help, yet the person died, okay, the law states that you should not be blamed for the death of that patient. Only if, number one, you act voluntarily, okay? Nobody force you to help. You help without expectations or expecting anything in return. So there should be no parang hidden agenda, okay? So that way, if you help lang talaga because you really wanted to help, you're a good person, you wanted to help, and then you don't expect anything in return, nothing, you don't ask for anything, then you will be protected by the Good Samaritan law. Okay? So it's better to help and then the person revived rather than not help at all but the patient died. So I think para sa akin, mas ano pa yung konsensya mo if alam mong you are capable of helping yet you decided not to help because you don't want to be involved in that. So I think it's a good point in heaven if you help someone, whether the person died or not. So it's in your heart. Okay, that's a Good Samaritan law. And the good thing about Good Samaritan law is that even your identity can be protected. So if you don't want to state your name, you don't want to be taken a picture whatsoever in the police, that is your right because of the Good Samaritan law. Okay, but you have to prove, or at least they should not be able to prove that you are doing that in return of something. That's a Good Samaritan law. But Ahmed said that it's not readily available in Dubai because the good thing about here in Dubai, in 3 minutes the help would already be there. Have you encountered help from 999 or 998 in few minutes?
Yes, sir, in the office.
Now, so you appreciate the rescue team here in Dubai. Maganda ba ang kanilang service?
Oh, sir, mabilis. Mabilis sila dun.
In the
Tsaka
Philippines?
talagang, sir, abutin ng
After
siyam-siyam.
1 hour.
In the Philippines, napatay na lahat ni Cardo yung mga kalaban, tsaka pa dumating ang pulis. O, di ba? Naupos na yung bahay mo, tsaka pa dumating yung bumbero.
Bumbero.
Sa
Kaloka.
bangga,
Pero,
nagsuntukan na.
pero
Sir,
dito, in
question,
fairness,
sir.
ha? Ah,
Sir, question. So sa ibang bansa or sa atin sa Pinas, pwede tayong tumulong, sir,
yes.
or mga first aid.
Yes. Only exemption sa Dubai. Sa America, sa Europe, they've always encouraged everyone to help, to call 998 and to do CPR when it's needed. But in Dubai, may ano siya, hindi naman siya sinabi talaga na bawal, hindi lang siya pinopromote.
Okay, sir. Thank you, sir.
To provide.
Now, there are actually two organizations, yung parang talagang sinusunod ng universal, mga all over the world, for procedures on how to provide CPR. One is yung American Red Cross, and the other one is American Heart Association. Okay, but for my class, we will follow the American Heart Associations. I will discuss more about this in the next 10 minutes because I only have less than 1 minute on this slide. So we'll take a break and then I'll see you in 10 minutes. All right.
Okay.
Ano?